neurovascular bundle in your upper chest. If your symptoms are in your wrist, I'm still going to treat your wrist. Okay? And I'm not going to use the Indiana protocols, I'm going to use the crane brain. And I'm going to say, if your wrist aches constantly, then you should probably wear the splint constantly, so your wrist doesn't ache constantly anymore. Right? And I do find, though, that even though I don't think it's a distal, entrapment or compression, it's still, in my mind, anti-inflammatory, and the anti-inflammatory strategies, absolutely. So, ice, not heat. Okay, you can do contrast baths. Okay. Yeah, I mean, I'm a lover of contrast baths. I wrote an article on icing and contrast bath. I didn't put the contrast bath link in there when I talk about that. But I got you a link to my articles on icing. And I'm hardcore. I'll tell them to shoot for 3 to 5 times a day, but that includes cheaters for real life, which I have written into my handout. But ice, activity restrictions, all those things. And then for the proximal part, proximal icing. Throw an ice pack on your neck, upper back. And I'll tell them, I really, really, really want you to try both. I want you, to ice up here, and then your elbow or your wrist or whatever's bothering you, ice both until you can really convince yourself that one makes a bigger difference than the other. And at that point, sure, if you find that it's the proximal that does you better versus, vice versa, whatever. Stretches, especially chest openers, which we do have slides on that. Ergo strategies, which should be in the treatment plan of the handout that's my eval template, not the PowerPoint slides. And I do have an article link on that too. The article just kind of covers the basics. I mean, I usually do a two-hour class for my clients to really explain the rationale, which kind of gets that good compliance. If they can understand the wheres and why fors, then they can prioritize what strategies they're going to do in their stressful lives. But yeah, ergo strategies mostly postural, and one of the quick, easy ones is try to line up your ear hole in your shoulder. Whether you're at your desk, whether you're walking around the block, whether you're sitting in church, try to line up your ear hole with your shoulder, and especially at your desk, and your elbow should fall down by your side, maybe a little bit forward of your shoulders, but your elbows and your arms shouldn't be way out here. What am I doing now? Well, I'm putting those muscles in a shortened position, so we're getting to the whole thoracic outlet thing. So, and you don't need, side arms on your chair. Really, if you put your arms down by your side like this, they're not heavy. Really. I mean, I obviously don't look like I go to the gym every day, right? I can hold my arms up all by myself. I do not prop them on my chair arms. I do not prop them on the desktop, okay? Promise. Same thing with posture. I do not lean against the back of my chair. If you're leaning against the back of your chair, then you're wrong, because I don't know very many chairs that you would be leaning against the back of the chair and you would not then have to do this. And then, in order not to do the turtle thing, your monitor would have to be up here on the ceiling, right? Okay, so I can sit up straight, without going to the gym and conditioning myself every day. I can sit up all by myself without the back of the chair. Okay, so I rarely address wrist position specifically. If you get everything else right, open up that elbow angle from 90. The more you have your elbow bent past 90, the more slack you're taking out of the ulnar nerve, whether it's, at your keyboard like this, or whether it's your crappy sit position, you're taking the slack out of your ulnar nerve. So elbows open up a little bit. Yes, ma'am?
The sit position, is that also like prone?
I got a few slides on that, and then I didn't put all the slides in there, but I'll probably do my own show and tell. It's a good question. It's very important here. Okay. The elbow pad is in that bag somewhere.
Rosemary,
Yes.
One thing I see that's easy to, besides chair and desk, is monitor height.
Yeah.
People have them too low.
I know. What is with that?
And you need to have it, your eyes should be about
The top 1/3.
third.
Yeah.
Exactly. When
Yeah.
you do that, it changes
And I mean,
everything.
you don't have to go to Office Depot and buy everything. Everybody's got phone books or, the outdated editions of Hunter or Greener. I use my outdated editions of Hunter.
Yeah.
Two Hunters fix the whole thing. I don't know if I can do that. That's part 1 of 3 that I can do. I find this more helpful than the wrist splints when you're talking like the carpal tunnel, you know, waking you up at night when you're sleeping. I wake up plenty of nights with my carpal tunnel fingers not numb and tingly. We're talking dead as a doornail. I mean, I'm like trying to find the alarm clock, and I'm like, try to use your little finger. You know? But you know what? It is not my median nerve. What is it? What do you think it is? It's my radial artery. Because I love to sleep with my big fat head on my hand. How much does a head weigh? I don't know. A lot, right? You know? So here I am calling myself a side sleeper. Yeah,
You're on a leash. I don't know how far you can get.
Okay, well, we'll have to pretend a wall or a surface. Okay. How about back here? Does this work? So this is side sleeping. Stacked. You want like a line that would go through both of your shoulders to be perpendicular pretty much, and a line going through your hips. Okay. I use 2 bolster pillows because I've tried everything under the sun. At one time I had like 6 pillows in the bed because I sleep on both sides, you know. So then you have to flip over and you have pillows there. So these little bolster pillows, they fit in a just a standard size pillowcase. They're only this long, and you just like drag them back and forth. And so I just put them here and lay my arm over the top. I can get by with the ballpark of 90 degrees flexion at my elbows, but I really love to sleep like this.
Yeah.
Okay, so compressing both nerve and vascular bundles and sleeping on both hands. And so yeah, I wake up plenty. But you know, being an occupational therapist, it's like, okay, you've done it again. It's like, okay, bring your arm out and see if you can just feel that it's the blood returning. Yep, there it goes. So I think that one of the reasons that carpal tunnel surgery doesn't fix the problem is because you didn't have carpal tunnel. So patients like the elbow pad better than the wrist splints. And so, everybody, you ever seen this one? It's a little well-loved and maybe dirty. I think, you know, our military system of ordering, the NCOs take care of that. I don't know where it came from. But you pull it on, and you put the pad in the front, and then you take, if you need to, a single sock or a sports sock, and you cram it down into your tube, because your arm doesn't have to be rigid like those long arm splints that our lieutenant was so fond of. You know, you can have some movement, but when you start getting to 90, if you need to put like a small, you know, ping pong ball or something in there, but something to kind of alert you, you know. I mean, after a while you get used to it and it doesn't even wake you up, but you know, just something enough to tell you, you know, okay, back off. Now me, at one time the reason I'm so smart with all this is because I have experienced most of these things. I had some terrible ulnar nerve symptoms at one time. I had a bicycle accident in Germany. My bike threw me. And I couldn't sleep on this shoulder for like 6 months. Then of course, after it got better, of course, I go back to my crazy sleeping. And so that's one thing that I was doing. I mean, I was already taking all the slack out of my ulnar nerve. And then the other thing is I went to a lot of concerts.
Oh, yeah.
And I don't like to just use the binoculars occasionally. I like to look at the guitarist's hands. I don't know why. I don't play an instrument, but I love to look at the guitarist's hands. Okay? So after a little while looking at the guitarist's hands, you know, I'm getting TOS-y, and I'm getting cubital tunnel-y, and so I'm kind of, you know, trying to rest it I've had some treatment and some massage therapy and all kinds of stuff. But so what I found was, it's not that I physically couldn't wear the 2 wrist splints and the 2 elbow pads, but this is emotional comfort, right? This is emotional. So here's how I cheat. I tell my patients how to cheat all the time. You know, lieutenants and the new grads, they don't like to talk about cheating. You know, here's your cheater. We call them cheaters for real life. So your cheater for real life is I would wear my elbow pad on this side one night and then comfort myself with this hand. And then the next night, I'd wear the elbow pad on this arm and comfort myself with this arm. Okay. Stretches. Okay. So this is one of our Air Force troops. So favorite chest is the chest, favorite stretch is the chest opener. Okay, now he's showing, you don't even have to get up out of your desk chair. It would be a really good idea, because if you only had one ergo tip to tell people, and it had to be simple, you say, just get out of your chair and walk around for like 30 seconds, you know, every hour or so, okay? But you can do them in your chair, and you don't have to do both sides at one time. I mean, like at one time, I could not have done both sides. I've injured both shoulders at one time or another. You can do one side at a time. You can do this, right? You can do this. You can do this, okay? So, chest opener, that one. Just the lateral stretch. So this is stretching like your sternocleidomastoid and your upper trapezius, right? Now, I don't know about you, but I do not have to pull on my head to get enough stretch to bounce a quarter off this thing. Okay, this is the levator stretch. So this one's a little complicated, so then you have to kind of cheat for your patient. So technically, it's not the side bend. It's like pointing your nose to your armpit, and then it's like pressing down through your shoulder and then across this way. Can anybody see this? So it's like depressing your shoulder and kind of pressing across this way, and then you should feel that that's a different stretch than that trapezius, upper trapezius. Now your patients, we just usually tell them to hold nose to the armpit thing and then just hold on to the bottom of your chair. Okay, and so this is a pretty decent stretch for, like, especially the rhomboids, you know, the muscles that kind of tether your shoulder blades to your upper thoracic spine. Don't do that when you mic, you get feedback. Okay, and then chin retraction. And what's that exercise program? I keep getting it wrong. Exercise Pro. In Exercise Pro, it says chin retraction, and then they go and screw it up and put chin tuck in parentheses. This is chin tuck. This is like, you know, Miss Manners and you got the book on your head, right? So most clients will tell us that they do this in their car pressing into their headrest when they get stuck in traffic. Okay, so if you want to do a couple of these and then add the chin tuck, if you couldn't already feel the tight muscles that attach to the base of your skull, you will then feel them, yes? Okay, sleep positions. Okay, so here's our side sleeping, okay? Compressing both nerve and vascular bundles in the upper chest at the same time. That's some proficiency there. Okay, so this is better. Okay, and you know, if you don't have the whole bed to yourself like I do, you know, and you can't stretch the arms all the way out, like I say, I can usually get by with about 90 degrees of elbow flexion on either arm. It would be great if everybody slept flat on their back, but life is just not that way, is it? The only clients, I mean, you know, exceptions, but basically the only clients that I know that sleep flat on their back have had a super serious neck or shoulder injury. The rest of us are side sleepers. But it would be great. And you know, you can put your hands down like this, but you don't want to do this, right? If you put your hands on your chest like this, now you're taking all the slack out of your ulnar nerve again. Okay, what else you want to know about sleep positions?
What about if they put their hands over their head?
What do you think? Tell me.
Well,
What? Sleeping like this, what does this do?
Your elbows still.
Same thing. It's still, this is the light bulb. This is definitely compression of the nerve and vascular bundle. Sleeping on your stomach, completely flat on your stomach, unless you got a big hole cut in the... Yeah, unless you're sleeping on a massage table, your head's got to go one way or the other. So when your head goes this way, what's happening?
shortening.
You're shortening one side.
You know, and you're doing this. So this is the side you're compressing. So, yeah, no. And you know what? Nothing's 100%. You just when you wake up and something's asleep, then at least just start out in a good position, right? And these things take time. Believe me, I'm still working on it. You get a few good weeks and months, you just go right back to that comfort. You know, I mean, I don't feel sick, but I don't feel well. I had a little nap this afternoon. I had to skip Dr. Kitty, but I wanted to be fresh for you guys, and heck yeah, I comforted myself. Okay, so